tend to see a lot of children for chronic ear infections, chronic tonsil disease. The American Academy of Otolaryngology has set forth guidelines as to when it's appropriate to proceed with surgery. Typically, we look at 6, 7 ear infections in 1 year, or 4 infections per year for at least 2 years, or persistent fluid in the ears and associated hearing loss related to that fluid that does not seem to clear after 3 or 4 months as a consideration for use or placement of ear tubes. Understanding that many children grow out of recurring ear problems by around age 3 or 4 when the eustachian tube takes the positioning in your head in the natural anatomical position of adults, which allows it to work more efficiently in terms of getting air into the middle ear and draining the fluid more effectively. Sometimes biding time is important, but there are some people that we need to put tubes in, which can be dramatically helpful for a child's quality of life, and then removing the need for recurring use of antibiotics. We also see the same thing with tonsillitis and enlarged tonsils and adenoids. There are many patients that come and see us that their child's tonsils look big and the child has some snoring. We typically look at 2 reasons to consider taking out tonsils and adenoids in children. The big thing would be recurring strep or even non-strep infections, usually 6 infections in 1 year or 4 infections per year for at least 2 years. Also, the other big one is sleep apnea. There are many children between the age of 3 and 8 that have enlarged adenoids and tonsils. A lot of it has to do with the size of their normal nasal and oral cavity, and eventually as they get older the tonsils may get smaller, or the size of the oral cavity gets bigger and the tonsils take up less space, and a lot of the snoring symptoms do resolve. Typically, snoring is not a big reason for us to take out the tonsil adenoids, but if they're having a lot of sleep problems, it can affect their ability to gain weight, to eat, and to perform effectively in school. And those are the children that we often lead to taking out tonsils and adenoids to improve their sleep and their quality of life during the day. Any type of surgical procedure has some complications. Taking out the tonsils is not going to impact their immune system or their ability to fight infections, but can actually help improve their quality of life by reducing the number of missed days of school, reducing the number of days that they're on antibiotics because of recurrent infections. I use a coblation device to remove tonsils and adenoids, which tends to have less deep penetration into the throat tissues, which has been shown in children to decrease the risk of pain after surgery, to allow children to be able to eat and drink better and minimize dehydration and other complications from tonsillectomy.